According to the Celiac Disease Foundation, about 1 of every 100 people in the world has celiac disease. This includes about 3 million Americans, and many more remain undiagnosed, 60 to 70% who indeed have celiac disease. The symptoms of celiac disease can range from pesky and irritating to downright debilitating. When treated, which includes following a gluten-free diet, celiac disease can be managed. However, many individuals affected by this autoimmune condition wonder, will it ever just go away on its own? Before we answer that question, let's make sure we're on the same page. So, what is celiac disease? Celiac disease is a chronic disorder of the digestive system and immune system, mainly affecting the small intestine. When an individual with celiac disease eats food that contains gluten, a protein, it damages the small intestine because the immune system has mistakenly determined that gluten is a threat to their health. As a result, it creates antibodies to defend the body against gluten, which leads to the intestine becoming inflamed. If an individual is struggling with celiac disease, they might experience symptoms like constipation, bloating, diarrhea, nausea and/or vomiting, abdominal pain or discomfort, lactose intolerance, joint pain, and dermatitis herpetiformis, another immune disease commonly found in people with celiac disease. Important note, celiac disease involves an immune reaction, whereas gluten sensitivity does not. So these are two different things. People with celiac disease have an immune system that essentially attacks itself and hurts the small intestine in the process. This reaction does not happen when someone has a sensitivity to gluten. However, if eating gluten bothers an individual, they should speak with their healthcare provider and even a registered dietitian about potentially trying a gluten-free diet. More on this in a moment. Now, can celiac disease heal on its own? Back to our original question, can celiac disease simply go away all by itself? No. Unfortunately, there's no cure for celiac disease. However, it can be managed by following a strict gluten-free diet. This means avoiding foods or ingredients like wheat, barley, and rye. Triticale, a wheat and rye hybrid, is another offender, and in some scenarios, oats. Many processed foods also contain gluten, but it's sometimes hidden. Remember that gluten is a specific type of protein. However, a food that has protein, which is most foods, doesn't necessarily contain gluten. For example, dairy products can be excellent sources of protein, and usually they're naturally gluten-free. If they have added ingredients like coloring or flavors, this might no longer be the case. Fortunately, these days there are plenty of delicious gluten-free alternatives for bread, pasta, and much more. You can find them at most grocery stores. After switching to a strict gluten-free diet, how long should someone with celiac disease expect to wait before their symptoms go away? Switching to a gluten-free diet in many cases brings almost immediate improvements. Some of the symptoms can very quickly subside. Beside that, it can take several weeks or months to resolve nutritional deficiencies and for inflammation to heal. Patience is key because if an individual has been eating gluten for years, there could be more damage to repair. Now, what happens with untreated celiac disease? Gastrointestinal symptoms, nutrient deficiencies, and inflammation aren't the only concerns with untreated celiac disease. Those with celiac disease tend to also have other autoimmune diseases. Other potential complications include iron deficiency or anemia, osteoporosis, epilepsy, migraines, heart disease, intestinal cancers, infertility, and miscarriage. This is why it's so important to get tested for celiac disease, and if you test positive or even if you have a mere sensitivity, have a conversation with your provider and possibly stop eating gluten immediately. Additionally, because people with celiac disease sometimes suffer from nutrient deficiencies since it's harder for their body to absorb nutrients, vitamin and mineral supplements might be in order. To treat dermatitis herpetiformis, a healthcare provider might prescribe medication, and for severe inflammation that isn't healing quickly enough on its own, corticosteroids can help. The aforementioned symptoms of celiac disease are the first warning signs to look out for. However, it's still important to get celiac disease diagnosed before opting for a gluten-free diet. eNational Testing Celiac Panel is a simple blood test that checks for an immune response to gluten and can also determine an individual's risk of developing celiac disease. Results are available in 3 to 6 business days. These tests can be an important step in the diagnosis of celiac disease. We have more than 2,000 locations around the nation, and we offer same-day service. Simply order your test online and visit the location most convenient for you. Use our online map to find a testing center in your area. Should you have questions after receiving your test results, you can speak with one of our clinicians regarding the next steps or treatment for celiac disease. If you need extra support in creating a gluten-free diet, a registered dietitian can also be helpful. We know that it can be tricky to avoid eating gluten. It might feel like it's hiding everywhere. However, you might find a lifelong gluten free diet becomes easier to maintain with a little time and patience. Get tested for celiac disease today with eNational testing, and then work with your healthcare provider or registered dietitian to come up with a plan that works for you.